Well, good evening, everybody. And just want to let everybody know that this webinar is being recorded. And if you do not want to be on the webinar tonight for any reason at all, because it is being recorded, we invite you to drop off now. Okay, I took care of that legalese. And let's jump right in. First, just want to welcome everybody and people joining us in the last minute or two here. This is a Massachusetts Soccer Association COVID-19 Safety Officer and Team COVID Coordinators webinar. We felt it was important since the last webinars that we've done to touch base with everybody. For the most part, tonight will be a Q&A. And we will cover a few subjects that are recent changes, recent amendments and such. But this is your opportunity to ask questions. Now, before we start tonight, introduce ourselves. You've got myself, Mike Borslow, Executive Director, and Tammy Endow, whose name is above mine because she's more important than I am when it comes to everything COVID-19. Is our Massachusetts Soccer COVID-19 Safety Officer. And if you haven't had the pleasure of working with Tammy, she's out there to help you handle anything that comes your way with regards to our return to soccer activities, guidelines, protocols, procedures, and the such. So Tammy's on with me tonight. Before we start, though, the most important thing is thank you. Thank you in more language than I can pronounce. I'm difficult with English, but is thanks to everybody who's on tonight. Who would have ever thought a year ago that we would have this role called a COVID-19 safety officer? I always thought, well, maybe we need a shin pad officer or a tuck your shirt in officer, which now you don't have to tuck shirts in anymore, or some type of another person out there to make sure things were going right. And then lo and behold, here we go. We get coronavirus in March, and now we have a couple of new positions: a COVID safety officer, which more or less is the one go-to person for the member organization, whether it's a league, a club, or a town. And then we have team COVID-19 coordinators or COVID coordinators, who every team should have to assist the coaching staff, the team management staff with those duties. Who would have ever thought? Not me, but I do need to say thank you. I know Tammy expresses the same, for your volunteerism, for stepping up for this role, for helping out. You are making our jobs at the state so much easier. And so we want you to know that we're here for you and to assist as much as we can. So with tonight's presentation, we've got a few slides we're going to go through, but if you notice there's no chat, use the Q&A function. It's the, it's on the navigational bar. Some of you have it on the bottom of the screen, some have it on the top, but it's the Q&A button. You just click on that and post your question, and that we will get to all the questions at the end of our short, brief presentation up front. And feel free to ask away. We have had some submissions, which we have printed out, and a couple of email questions that came in, and we'll get to all those at the very end. So please post your questions, and we'll get to those at the end. So first thing we wanted to just touch on is the COVID coordinator adult registration. We did receive a fair amount of feedback from folks, especially the COVID safety officers, that were letting us know that they, for the most part, the first ask for COVID team coordinators went pretty well. People were stepping forward, but quite a few people were reluctant to take on that responsibility, then at the same time have to go through all of the compliance needs for an adult registration. So after talking with legal counsel and internal reflection, so to say, we came up with a process whereas if you are just going to be a team COVID coordinator, complete the adult registration process, but you do not have to do safe sport training or the concussion training. Complete the process, go through the adult registration. We're going to run a background check, and we'll run for a state query and a national background check. And assuming you come back from those all clean, you're ready to serve in that role. So you will not have to do any of the further trainings that are necessary. So that's makes it a little bit easier for us to attract some more team coordinators. An adult credential is not required as long as the adult who's in this role is not on the field of play or on the bench side. Basically, what it comes down to is as long as somebody in this role is not involved with the players, with children. Now, if they're in any other type of a role where they're helping out, assisting a coach, running activities with children, then they do have to go through the entire adult registration and educational requirements. So that's the one of the simplification processes that we just recently announced for Team COVID coordinators. From here, I'm going to turn it over to Tammy, who will pick up on several other subjects.
Thanks, Mike. With the release of orders 51 and 52 and the corresponding EEA guidelines by the Commonwealth of Massachusetts that were effective just this past Monday, October 5th, we have updated our return to soccer activity guidelines. And so you will see the cover of those here. The date has been changed on the bottom, so please be sure, and members of your organization are referring to our guidelines, that they have the most current version, and to be sure that we have the correct policies and procedures.
Oh, Tammy, you just went to mute by accident.
I don't know how that happened. Sorry about that.
May have hit the space bar. All right.
The next few slides that we have are going to go over some of the updates and changes that we've had in this recent update. The first is the face covering guidelines. Now, we haven't changed them. We have updated the guidelines a bit based on some of our member feedback that the guidelines may not have been clear. A face covering will be required per the most recent EEA guidelines while actively playing and while on the sidelines. And it's all players and coaches. A face covering must be worn during arrival and departure from the field. Next slide, Mike. Face coverings must be worn when a player steps on the field. At no time should they enter the field to play without a mask on. When they are on the field of play and the spacing is greater than 6 feet from their closest opponent or player on the field, they may take their mask off to take a quick mask break, catch their breath, but then they will need to replace the mask as soon as possible. For all intents and purposes, the default expectation here is that the mask, that the face coverings will be worn at all times. One thing I noticed this weekend at the fields, or actually maybe two things, is that when the players are coming off the field and are returning to the sidelines, they grab a sip of water, but they forget to put their masks back on. Please, as coaches, I know you have a lot going on. If you could just take a glance over at your sidelines from time to time and just make sure that the players are putting their masks back on and that they're spaced out. The other is that the coaches themselves have a tendency to pull their masks down when trying to communicate with players on the field or right in front of them. Masks by coaches need to be on at all times. There's no exception for that. Next slide, Mike. So I just wanted to take a couple quick seconds to go over what we're considering an acceptable mask, because sometimes there is questions in regards to that. Right now, the only acceptable masks for our players and coaches to be wearing are a medical grade or a cloth mask that covers your nose and your mouth and loops behind your ears. Next slide. Unacceptable masks. So there are masks with valves in them I mean, even the N9, there are some N95 masks out there that have safety valves in them. Those are not acceptable. Particles can escape through there. Thus, if you have contracted COVID-19, you're spreading those particles into the air. The other, is a mesh mask for obvious reasons. There are lots of holes in there, and that is not protecting anyone. Next slide, please. So the next thing I wanted to cover is spectators. Obviously, this picture was taken before the 6-foot rule, but one of the changes that came with orders 51 and 52 and the corresponding guidance from the EEA was an increase in gathering numbers. However, Mass Youth Soccer has not modified our current limit of 1 spectator per player. Our primary reasons for this is that we are committed to supporting the Commonwealth of Massachusetts and the EEA's commitment to limiting the gathering sizes across the state to help reduce the spread of COVID-19, as well as it assists in tracing the activities that have to take place if there is a positive test result. Next slide. There are 2 other reasons that are also very important, that were very important in us making this decision. First of all, it was the ability to manage the numbers for lower risk communities to have increased gathering sizes. This would be a challenge on many levels, especially with towns that are traveling, and you may go from one community to the next. You may be in a low risk community. The community you're traveling to is a high risk community. Keeping that information straight, because it changes sometimes on a 24-hour period, and communicating that to our families and players and families that would be a daunting task. So in order to maintain consistency across the state, as well as supporting the reduced gathering limits, again, we're staying with 1 spectator per player. And the last reason is, even though in the lower risk communities have been granted the opportunity to increase their gathering numbers, there are regulations around how they go about doing that. For all intents and purposes, anything over 50 has to be approved by the Board of Health. There's a process that goes along with that takes time. There's a lot of lead time involved in that. So the chances of that getting done in a timely manner for you to communicate that again to your families and to any other people coming into your community, it would again be difficult. It also supports our Board of Health. They are overwhelmed right now, and the last thing they need to be doing is approving increased guidelines for soccer activities. So we'd like to assist them with that, and we will remain with a 1-to-1 ratio. Next slide, please. Attendance. So this is another question that I'm getting frequently. Next slide, please, Mike. And the question is, do we need to keep attendance logs of players, spectators, referees, administrators, your dog, your cat? But what we have decided is for all outdoor soccer activities, Massachusetts Youth Soccer does highly recommend attendance logs be kept for all players, coaches, referees, and other on-site administrators. In addition, all efforts should be made to keep an attendance log of spectators at each soccer-related event. It is extremely important, even if you are not keeping track of spectators, while we would love for you to do that, which honestly with a 1-to-1 ratio should be very simple. It's very important that you have all your updated contact information for each and every player, because if you do have a COVID positive case, notification needs to go out to these families. Next slide, please. Which leads me to why we need to take attendance. So taking attendance, it provides us the ability to notify the participants and their families in the event of a confirmed positive case of COVID-19. It aids in the contact tracing process and helps protect our families and our soccer community by letting people know that they've been exposed to COVID-19 and should monitor their health and signs and symptoms for COVID. It also will help people know that they should go get tested because they are a possible contact. It will aid in helping people to self-isolate or to self-quarantine if they're close contact. And lastly, it helps our public health departments in their contact tracing efforts and their ability to identify a possible COVID-19 cluster. Next. So then that brings me to reporting procedures. Some of you are familiar with this already, but if you go to our procedures page on our website, on the right-hand side, there's a lot of documents and subheadings. The subheading COVID exposure notification procedures basically will walk you through what you need to do to notify us and your members or the affected or team of the possible exposure. The first thing you need to do is, once notified, you should notify your president and your COVID safety officer. At this time, privacy is the utmost importance. Cannot release the name of the person involved who has the possible case of COVID. It's a HIPAA regulation, and we want to be sure that we are.
Oh, you just went to mute again, Tammy. Tammy, you just went to mute.
I know.
Thank you.
Okay, am I back?
Yes, you are.
Sorry. My keyboard is very sensitive. I'm sorry. So once you notify, you will notify the, I'm sorry. So you will, once you are notified, we ask that you notify your local Board of Health if the case. Now, we will do that in order to get some guidance from them in regards to how you should handle whether your team should self-quarantine. They'll provide guidance in whether or not you need to notify the other team that you just played over the weekend. The next step in the process is to notify the families. There's a COVID notification form available there, which is a sample email. All you need to do is cut and paste it and send it out to anybody on your attendance log that they are now, there you have a possible COVID-19 case, and that there's possibility that they will need, or that there is a COVID-19 positive case and that they will need to self-quarantine. The next thing is there is a COVID notification form where you would contact, that comes directly to me. And in this form, you would, this form comes directly to me and it provides me the information of when you were notified, when you notified your families. Is it a confirmed case of COVID-19? And has the Board of Health contacted you? Okay. Next slide. I'm not seeing the slides for some reason, but
That's the FAQ.
Yep, the FAQ. So on the FAQ page is also found on our guidelines website. And what we did was we compiled a list of questions that we have most frequently received from you, our members, to try to streamline things, make it easier for you folks to get some quick reference to any question that might come up. Now, obviously, not every question fits not every answer fits every question completely. So if you don't see your question or the answer doesn't quite fit, feel free to reach out to me at any time, and either via email or via telephone, and I would be happy to walk you through it. And if I don't have the answer, I will definitely get you the answer. That's all I have to present on that stuff, and we quickly have arrived at our Q&A.
Okay. Great, Tammy. Thank you very much. Really
Mhm.
appreciate that. Some of you will see that another panelist showed up, Mary. Relic is there. Just in the event anybody has any questions with regards to the team coordinator process and how to verify them within the US Soccer Connect system. But so let's get going with some questions that have come in, and I'm sure this will also create some. So question that actually was mailed in earlier had to do with red towns. It still reminds me of, I think it was Clint Eastwood, The Good, the Bad, and the Ugly, and painting the town red. But so a red town is, or was that High Plains Drifter? I'm not sure. Anyway, when it comes to soccer, Mass Youth Soccer is neutral on the zone color of a town. So red basically means it's a high risk community. Anything below red, which is yellow, green, white, is considered non-high risk or lower risk. They don't classify them. They're just one bit. So if a town has gone to red, soccer can still be played. What the classification basically does, it's a government related, it's a state government related classification, which will then dictate what's take place in schools, what takes place with regards to setting up testing and testing stations, and any other benefits that come from the state. But we're not precluding anybody from going to play a team that's in a red community and vice versa from the red community going into another community. That is not our issue. We're totally neutral on the ratings. We want kids to play. However, the local board of health may put some restrictions. A classic example, and our heart bleeds for the folks in certain communities, such as Haverhill. Haverhill has gone red, and subsequently the mayor has shut down everything in the town, including fields. So they can't play their soccer in Haverhill at this time. So that's out of our hands. That's what the town may do. Certain boards of health may shut activities down. So once again, Mass Youth Soccer is neutral. You just have to pay attention to what's happening locally with regards to the color of a town. I know some questions are going to start coming in that I will probably get to later on. And with regards to this, we're going to bounce around with subjects tonight, just so bear with us. Somebody did also ask a question. What if we've got a parent sitting as a spectator who does not wear their mask because they have informed you that they have a medical exemption, but they also are not following social distance policies? So in essence, when it comes to a mask, if somebody has a medical exemption, that is all dictated by the Commonwealth of Massachusetts. That if somebody claims they have a medical exemption, you can certainly ask them what it's about. You can't ask specifically what the reason is, but you can say, do you have doctor's orders? And they could most certainly say they do, but the state Commonwealth says you cannot ask them to provide that. That's in the mask order that came out, I believe, in April. So somebody says they do, you have to trust that they do. We did introduce a new waiver form that is on the website. It's on the right-hand side on the resources, along with the other things we just showed you, that actually has them sign off that they do have an exception, but it also has them sign that if they are found to be falsifying or telling untruths, that they could very well be banned from soccer activities for up to a year. So it kind of puts a little bit of a sting in it if they're lying to us, but you just have to trust them. So now with them not socially distancing, if they're with immediate family members, which they shouldn't be because it's one spectator per player. If they're with people that possibly live in the same, if a multi-household family household, yes, they could be with other family members from the same household, but highly unlikely that's going to happen, and they must socially distance from everybody. Questions have come up. What if somebody refuses to be socially distant? And so the approach there is asking politely the first time, ask them politely the second time, and if the third time they say, nope, I got my right to not wear a mask and not to be socially distanced, you can just politely let them know that please leave the premises. And if they don't leave the premises, that you're going to have to call 911. And we've had several cases where 911 has been called this year, and they've been handled quite differently by different organizations. I believe we have some tips on this in our FAQ with how to deal with local authorities if this situation does come up. So another question came up here. What is the best way to handle trophies at the end of the season? Well, it's real simple. Don't. If you typically hand out trophies, you may have to take a pass this year, quite honestly. You know, we're trying not to share things. We're trying to minimize, you know, the transference of articles, let alone, you know, respiratory particles, but articles such as trophies, balls, pennies, shirts, you name it. So our recommendation is that maybe you just you take a buy on this, or if you feel that it's important, that you have some type of a pickup session. People line up 6 feet apart. No handshaking. No, you know, just pick up your trophy, move on. But that make sure that all the trophies are thoroughly sprayed with a sanitized, an approved, you know, sanitizing spray. If you get your hands on the good old Lysol, then there you go. But they should be sprayed and sitting for a while before they're picked up. So is it worth it? It may be, but that's the best way to deal with that. Question came in about Massachusetts alignment with travel policy and travel rules. So make it clear is that Mass Youth Soccer adheres to and expects our members to adhere to the Massachusetts travel policy. So if you've had players that go to any other non-high risk state as identified by the governor of Massachusetts, which right now all of our bordering states are considered non-high risk except for Rhode Island. So if you go up to New Hampshire or to Vermont or to Connecticut and then you come back, there's no requirements of quarantining for 14 days or testing positive within 72 hours of returning and such. So, you know, if you have a team that goes to play a game over state borders, as long as it's not Rhode Island and it's neighboring states, you're fine. If it is Rhode Island, when you return, the players, the parents, the coaches, everybody who made the trip either has to test negative within a 72-hour period or quarantine for 2 weeks. That's the same thing if a Rhode Island player were to come into Massachusetts. That technically the only way they can come into Massachusetts and participate in soccer is if they tested negative within the last 72 hours of coming over the border. By the way, that also includes the parents and anybody who drove them. They also have to prove they tested negative as well. And if they don't, they have to quarantine while here and then go home. That's not going to happen. So it's unfortunate. We're hoping that our friends down in Rhode Island start to see their numbers trend in the right direction so we can have some friendly cross-state competition.
Can I take the other part of that question, Mike?
Yes, you can.
And there's a question, the other part of that question is to clarify whether a negative test is consistent with Mass state rules is sufficient to allow a participation after contact with an exposed person. Then the CDC guidelines on that are the person should quarantine self-quarantine for 14 days, regardless of a negative test result. As we know, anytime within those 14 days from the last contact with the exposed person, you can develop symptoms of that are indicative of COVID. So just because I tested negative today doesn't mean tomorrow that's going to be the same case. So we would advise you, if there's a close contact with a person and the person has been notified of that, please wait for 14 days post contact.
Great, thanks, Tammy.
You're welcome.
Yep, another question. Refs are wearing masks with valves. What should we do? Well, it's rather simple, is that every league controls what a referee does and does not do while basically while reffing in their competition, in their games. So some leagues are permitting refs to wear various types of masks, whether it's the over the ears, a tie around the back of the neck, and or a gaiter, since the referee is not involved in play, is 6 feet away from everybody else. There's pretty much no chance that somebody's going to fall into them and grab a gaiter. Now, with regards to valves, we have made the statement that we don't prefer the valves. Primarily, it's the biggest reasons is players are wearing their masks while playing close to each other on the field. And so, a league could say refs can still wear a gaiter or a mask with valves, as long as that ref always maintains themselves 6, and we're recommending 10 feet away from all other participants, coaches, players, other referees, and such. But if a league also wants to take a step further and say no mask with valves by coaches and referees, that's totally permissible. So,
Do you want me to take this?
Manage their own capacity based on state county system. Sure. Yep.
We would love for everybody to manage their own spectators, but to keep things consistent across the board. So when numbers change at the last minute, that there isn't any confusion, that families don't show up with grandma, grandpa, their aunt, their uncle, and then someone else's parent doesn't get to attend. It lessens the confusion, the problems, and it's easier to it is really easier to manage across the board. Everybody knows it's one spectator per player, no matter what town I'm playing in and no matter where I am. I know it's not fun because everybody does want to go out and see their children, grandchildren play. But unfortunately for this season, we do need to just, in order to keep the risk down for our communities, would like to manage it one spectator per player.
Thanks. And I'll get to the second part of that, but the question was about, letting people manage it on their own. And Tammy answered that. The other is, we are in conversations with the EEA daily. I have a key contact there. We touch base every morning. I want to know what's happening around the state. I want to hear about the concerns that they're getting. There is a hotline. There is a email process for people to file complaints. And let me tell you something. It's Monday mornings are a lot of fun. The photos, the screen captures of Facebook postings, and we make the phone calls. But my biggest concern is what is getting back up to the EEA, who in turn reports everything back to local boards of health. And what we're hearing is, from the soccer perspective compared to other sports, that we are setting the standard. The one other sport that is up there and setting the standard is an indoor sport, which is hockey. And hockey has been 1-to-1 from day one, from when we're permitted to go on the ice. So any indoor facilities have been 1-to-1 from day one. And so by us staying with 1-to-1, we're in good stead with the EEA. We're supporting their efforts, and we don't plan to have any variance from that as we get through this season. Yes, is it an inconvenience that certain family members can't be with each other to go watch a child play? We apologize, but folks, we're fortunate to be able to play, even though we have our game modifications. There are 14 states that are not allowed to play soccer games at all, and we don't want to go back and be one of those. So we're doing everything that we can. Tammy, a question is there about spectator attendance and keeping the log? What kind of information should they gather if they do decide to maintain the log of spectators and the such?
I would just say that you should put down the person's name. If you can get an email address, if it's not a player's parent, then just to grab an email address from the spectator. And that way we're sure that they're 100% covered when the email notification goes out or when the Board of Health asks us for contact tracing information. And if it is player's mother or father, we all would obviously have that information.
Great, thank you. I'm going to answer this question, and there's another long one there, Tim. If you can read that one.
Okay.
While I answer the first, is it comes in terms of masks, can coaches and spectators use gaiters? Yes, they may. They can, because they're not involved in play. They're not there for the potential of a collision, an accidental grab or the such. So yes, they are permitted by everybody except players while actively involved in play.
Okay, the next question, which is a rather long one, is a question in regards to the notification process for a local Board of Health differing from our notification process. And that in this particular instance, the town was told by the Board of Health that they would contact everybody. We shouldn't reach out to them. So that's the first time I've actually heard that. I've had several notifications as I'm working with several safety officers who have been working with their boards of health. Most times we actually end up contacting the Board of Health before they contact us. And we're quicker at notifying our families that there's a situation. If your local Board of Health tells you that's how they want to handle it, then by all means, that has to be the process. Please still notify us that there's an issue, just so we know if something comes back. But there have been so many cases, and I know even on the news, they've pointed out cases where kids have gone to school and the school didn't know that the child had tested positive because the Board of Health was 2 days behind in notifying the school. If that is their procedure, then by all means we have to follow it. But I would, if we can get ahead of it in any means, we would like to try to do that to protect our community.
Okay. Another question. Could professional coaches from a partner organization who is a coach from Rhode Island drive to Mass to work? The answer to that is yes. Under the travel policy, residents of Rhode Island are given permission to come into Massachusetts for several reasons. One is to go shopping, go figure. The other is to go to work. And the others are to pass through and or to go to the airport, go to a train station, go to the bus station so you can get out of Mass as quickly as you came in. So, but it is go to work. So if there is a professional coach from an organization based in Rhode Island that comes into Massachusetts, or he or she resides in Rhode Island, comes into work, then that is fine. As an employer of that partner organization, I would ask that they do have them get tested every once in a while. Okay. We have a little clarification with regards to neck gaiters. Once again, the type of face mask, face coverings is all league based. And so in our general guidelines, we do permit anybody other than a player to have a neck gaiter. However, you do need to check with each league that you play in. So all the various leagues do have certain guidelines that they must adhere to. Some leagues do not permit neck gaiters at all. And the reason for that is that they figure if the coach wears a neck gaiter, then the next day or 2 days later, the player will show up with one. And that's because the coach had one on. So it's best that everybody checks with every league that you play in to see if there's any limitations for that league. I do know with our town select league that we actually tend to be a little bit more stricter than our general guidelines out of the safety for our players and coaches. And within the TSL program, the Town Select League, we do not permit coaches to wear gaiters at this time. Let me see. Can spectators change places? Sure. Just turn the music on, and when it stops, have them grab us. Yes, they may change places. However, while moving about 6 feet, social distancing, and the such. Then the question comes up, well, what if mom stays in the car for the second half and dad for the first? Perfectly fine, as long as it's one spectator per player at the field. So if they want to switch place midway through, that's absolutely okay, as long as it's one spectator per. The only thing there is, and we really don't want to, we're going to ask if anybody who permits that to take place, keep a log. Keep a log, because before you know it, we're going to have twice as many people in one facility. And if we have an outbreak and you haven't kept a log because of this mixing and matching, we're going to have a lot of problems, which ultimate means, and we've had this take place already, the Board of Health will threaten to shut you down permanently for the season. Board of Health doesn't like people to play games, and neither do we. But if this is a one-off, if it's one, that's fine. But if it's all of a sudden, we've got a full parental units are switching out at halftime, keep a log, keep that information, and be able to make sure everybody wears a mask, they keep social distancing, and the such. I mean, it's something that, you know, we're not asking our team coordinators to be the swapping out of parent, you know, police, but let's work together, because folks, if we go awry and things don't turn out well, we will not be playing soccer through the end of the season. Question down there, Tammy, of you
From
only need to
Brenda.
know of positives.
Yep. So people have notified me of close contacts. Yeah, obviously, if someone notifies you of a close contact, that player or coach who is the close contact does need to quarantine. They, from the team, self-quarantine. Doesn't affect your team. So if you're contacting me, you just know that it was a close contact. You're just contacting me for record. I definitely need to know about positives. I'm sure there's a lot of close contact situations. The only time I 100% would need to know about that close contact is if it switches to a positive contact. But I don't mind if you fill out that form and tell me it's a close contact.
So here's a question comes up, is that I'm going to kind of rephrase the question, saying that, you know, what if we have one parent on a sideline and then another parent is up on a hill or watching from a distance or the such? What you need to do is make sure that you understand what you're permitted for at a field or location. And so, because what will happen is nobody will ask permission. They're just going to try and have somebody watch, and then another parent is up on a hill and we're saying one spectator per, and they're going to say, well, that hill is outside the jurisdiction of the field permit. If it's in a public park, if it's at a school, that's entirely possible. So when you get your permits from the schools, from Parks and Rec, or from the town, or from a private organization, have them identify what is the area that you are responsible for with the permit. Now, this has come up in the past way before COVID, where people would walk a dog within 30 feet of a field and that they were chased away because they were told no dogs, when in fact, the permit gave them just the immediate area around the field. Now, what does immediate area mean? But we really never had to truly define it, but now we kind of have to. So work with your town, find out what your permit gives you the, the area for. For example, we have certain organizations that play on fields that are within a fenced area that are in a stadium. And the question comes up is, do they have jurisdiction over the stadium seating? Is that a part of their permit? Well, it all depends. Some towns will permit that to you and you're responsible for what takes place up there, and some towns will not. They'll say, nope, that's not a part of your permit. You don't have to worry about what takes place up there. You just have to worry about what takes place within the fence on the field or within the track on the field. So be aware of what your permits are for and what you have available to you. Another question that come up earlier was that I think we answered most of it, was a question with regards to we have people that have their children playing in various programs. There's 3 primary club leagues in Massachusetts besides our town-based leagues. Some of us have kids that play in both. My child did at one time. And there's the New England Club Soccer League, the NECSL, which is a Massachusetts youth soccer sanctioned league, supposed to be following all of our Massachusetts soccer guidelines. There's also the CCL of New England, the Champions Club League of New England. They're a Massachusetts soccer sanctioned league as well, and they're under our guidelines. And then we have the New England Premiership, which is not directly sanctioned by Massachusetts Soccer. They're under another umbrella from a national governing body. But the New England Premiership and Massachusetts Soccer have been working very, very close on helping to manage the entire soccer community here in the state. And the reason being is we want to make sure that we are both doing everything possible to make sure that soccer is not the reason why youth sports is changed in any way, meaning it's taken away. We want to make sure soccer keeps the bar as high as possible. So we work closely with them. They do use our notification procedures. They do consult with Tammy on these, mainly because we have a lot of players that are dual registered. They play in both Massachusetts soccer programs as well as NEP programs. So we have an open lines of communication. So they do follow our COVID guidelines. There are some minor differences when it comes to for masks. They do require all of their players to have masks on when they take to the field. They do require their players to keep the mask on while playing, but they do have a slightly different definition of when the mask can be removed. They do have a 1-to-1 spectator to player ratio as well. So there's for the most part, the similarities are very close, and they've done an incredible job in managing that, and we're doing everything possible to support each other. So just want to make sure that's clear. And that is I believe we took care of most of the questions. If there aren't any last minute questions, we will call it a night. And this is being recorded. It will be made available. And just lastly, I just want to say thank you to everybody. We really appreciate everybody that was on for all of your hard work. All of our contact information is on the website. So, if you have any questions, concerns, thoughts, ideas, please send them our way as soon as you can. And keep up the great work. Folks, let me tell you, I don't want to jinx us. I'm going to knock wood. I'm going to knock as much as I can. Is that our positive notifications to the number of children and adults playing right now is I know, shh.
Don't put this in the universe.
0.003%. We are demonstrating that youth sports is not leading to surges. Youth sports is not leading to huge outbreaks. But the only way we can demonstrate that is to follow the guidelines, to stay in our lanes, follow the guidelines, and not deviate. And that is why we've made some difficult decisions with regards to gathering limits to stay where we are, because we do not want to be the reason why youth sports is taken away. And we thank all of you for doing everything possible to make that reality. So thanks, everybody. Have a great
Thank you.